August 6, 1935. His father was a neurologist and always wanted him to be a neurosurgeon. When Herb decided to go into otolaryngology, his dad was reportedly disappointed. Of course, not knowing that Herbert Silverstein would become one of the most recognized names in otolaryngology, more specifically in the field of otology and neurotology. Herb Silverstein completed his residency in otolaryngology at the Mass Eye and Ear Infirmary in Boston, Massachusetts in 1966 and remained on the staff till 1971. He then joined the faculty at Penn until 1975 when he decided to move down to Sarasota, where he joined the staff at the Sarasota Memorial Hospital. And as I was listening to David Vander's presentation, I turned to Herb and I said, this is not the Sarasota Memorial Hospital we joined in 1975. A lot has changed. His continued academic interests in research and teaching led him to give courses in advances in otology and neurotology. He partnered with Dr. Horace Norrell, a neurosurgeon at SMH, to perform lateral skull-base and surgery and run instructional courses on neurological surgery of the ear and skull base. These courses eventually gave rise to the North American Skull Base Society, which is a major society in the field. He founded the Ear Research Foundation in 1979. He has received numerous awards to be listed, including the City of Sarasota Proclamation, the Dr. Herbert Silverstein Day on March 9th. That was given to him in 2012. He established a fellowship program in otology and neurotology in 1983, of which I was his first fellow. We are now interviewing for fellow number 50. Herb has authored and co-authored 250 peer-reviewed publications in 3 books. Herb is an inventor. He has designed and invented multiple procedures, such as the retrolabyrinthine vestibular neurectomy for disabling Meniere disease, and instruments like the facial nerve stimulator and monitor, a crucial tool that is being used worldwide to prevent facial nerve injuries in surgery of the ear and the skull base. Herb is also an accomplished musician. He is a composer and a jazz pianist. He started on drums, but then found the piano. He has recorded 16 CDs, most of which are of his original tunes. I had the privilege of accompanying him on the drums in one of his recordings in some of his live performances around town. Herb, it's been a privilege and honor to train with you and to partner with you since my move back to Sarasota in 2006. Thank you for all what you've done for our field. It is now my pleasure to introduce you to Dr. Lichtenstein, who will present you with the well-deserved Sarasota Memorial Hospital Lifetime Achievement Award.
who don't know, my first medical publication with my name on it came from a summer that I worked at the Ear Research Foundation with her while I was in medical school. So this is sort of, for me, full circle, that I'm now able to give you this award. Without you, I don't know if I would have made it this far in my medical career, so thank you. As a small token of our appreciation, please take this in recognition of your lifetime of service.
Jack and Richard, thank you very much for your kind words. Jack was my first fellow, and when I first came to Sarasota in 1973, actually, I met the 3 ear, nose, and throat doctors that were here, and they told me, "Welcome, we'd like you to move south and not come here." They said, "We have too many ENTs in Sarasota, we don't want you around. And to convince you that, we're not going to take call for you, and you'll have to take call 24/7. So, unfortunately, I'd already started an office in a 1,000 square foot closet that Bob Greenwood had. And anyway, I guess it didn't work out the way they thought, because I started sending them patients, and they decided to send me patients and decided to have to put me on call with them so they wouldn't have to work as hard. So that's how I got started in Sarasota. But it's been a real honor and a pleasure to be here, and a lot of fun, because I've enjoyed every minute being here. I've always been involved in research and development from the time I was a student in college and medical school, and I've always loved teaching, and I went to a great place at Harvard with Dr. Shuknek, who was a fantastic teacher, and he just imbued in me the desire to teach and continue what I'd learned at Harvard. And so we started actually the 3rd fellowship program in the country here, with Jack Wasson being the first fellow. And I could tell you some true stories about Jack, but I don't think he'd appreciate it.
Your time is up.
But anyway, it was great training Jack, and we've been close and remained friends through the years. And actually, Eileen, who's sitting here, who's been with me 42 years, has done everything in our office, from doing the records when she was 15-year-old to running the place. She was the one that got Jack down here, actually. She told me, she said, "Why don't you ask Dr. Wasson, who you like and who you've been friends with all these years and giving courses with, why don't you ask him to come in and take over for you?" And that, I called Jack, I said, "There's no way you want to come from New York in a big practice to Sarasota, Florida." And he said, "Yes, I do." And 6 months later, he was here. And the rest is history. And I think now he will build one of the largest ENT programs in the country here at the Institute building. And thank you so much again.